Hi there, my name is Rachel Melhorn. I'm the Family Bereavement Services Coordinator here at Full Circle Grief Center. I'm so happy that you all are joining us today for this pre-recorded conversations about grief. Today, I'm going to be talking to helping professionals, clinicians, school counselors, anyone that's in the role of supporting grieving children. I'm so glad that you're here and open and willing to learn a little bit about how to support grieving children and some hands-on interventions that you can use during your time with kids to kind of support them in their grief. First and foremost, I want to just acknowledge that as helping professionals this year, it's been a heavy job. There's been a lot of grief, there's been a lot of loss. Whether you're working with kids or teenagers who have lost a person in their life, or you're working with students or kids that have experienced tangible losses, right? Like the loss of connection, the loss of school, the loss of being able to participate in activities that brought them joy. So holding space for that group is heavy and it's hard. And so I want to acknowledge you for being here and showing up, and thank you for all that you're doing. We're glad that you're here. My role with Full Circle is, again, I'm the Family Bereavement Services Coordinator. So I oversee a program that we have here called Hands on Healing. If you're not familiar with the program, it is a grief support group for children ages 3 to 17 and their adult caregiver. Through the group, we provide an 8-week session with families. We provide a family activity, and then adult groups and youth groups to kind of allow parents and caregivers to have their own space to process their feelings of loss and also learn how to support grieving children. And then the youth groups for kids to just feel connected with other kids that have experienced the loss of someone significant to them. We also at our center provide loss specific groups and individual counseling. So I'll be kind of chatting a little bit about interventions, and some of these are ones that we use in our groups, and some of them are ones that we use in kind of our individual counseling program as well. So again, thank you so much for being here. I'm going to go ahead and share my screen with you all just because I have some visual things that I think would be helpful as we kind of go through today. Feel free to reach out to me with any questions. If you watch this and you're, not quite sure about an intervention or have some more questions, feel free to reach out. That's what we're here for. Thanks again. All righty. Okay. Share screen. All right. And again, my name is Rachel Melhorn. I'm a licensed clinical social worker and a registered play therapist. So I think I use a lot of aspects of play therapy in my work with kids and teenagers, and to be honest, adults and families, because I feel like it's important. So in knowing that about me and my kind of framework clinically is important. I think that play and art can be such a great way to meet kids and families where they're at. And so a lot of kind of what I'll bring today has some play and art-based elements incorporated into some of these interventions. Just some considerations for working with children who have experienced grief and loss. Kids go through a wide range, right, of reactions and responses after they experience a loss. Grief can look very different, right? Grief can look like intense anger or intense sadness and depression. It can look like total denial and a shut off of this isn't happening, this isn't real, I'm going to kind of continue to go on with my day-to-day life. It can look for like regression. In young kids, we can see a lot of regression in terms of toilet training. Can look like anxiety. Kids might have anxiety about going to school, worried that they're going to not see their other caregiver when they come home from school. They might have a separation anxiety when one of their parents or siblings goes to the grocery store and worried that they won't come back. All of these are normal reactions that kids experience when they have a loss. So I think sometimes we can be quick to pathologize or diagnose or say that kids have anxiety or depression or anger problems. And from my framework, I think just remembering that these are normal responses to grief and to something that's really, really challenging and hard. And so grief is a normal reaction, right, that kids will experience. And that each of their reactions and experiences is unique to that child. Each kid is unique. Each circumstances of grief and loss is very unique and specific. And so taking not necessarily a one size fits all approach, or the interventions that we're going to talk about today might not be right for every child. So just coming into it right with a unique framework and seeing the kid, the adolescent who's in front of you. One thing I think in terms of um, themes of things that kids and adolescents experience is that grieving children often feel really misunderstood and really alone or isolated. It's not necessarily something we might think about, but oftentimes kids have secondary losses, we call them. So they have the loss of their special person, and there's other losses that come with that, right? Maybe that means that their other parent has to go back to work, so they have less time with that person, or it means that kids at school make fun of them and they lose some friendships that way, or kids at school don't know what to say, so they kind of move away and isolate. Or kids isolate themselves, right? Because they feel different and they don't want to talk about their feelings. So, this is a theme, right? Feeling misunderstood and isolated that comes up a lot, which is why I think groups are such a great support in supporting grieving children. But again, right, your role as a helping professional, therapist, school counselor, whatever role you're working with a child, excuse me, you can support them, right, in feeling less alone and feeling understood and feeling like you know where they're coming from and hearing them out. And then finally, just considering not only a child's age, but their developmental stage in working with them. And because this impacts their grieving process a lot, right? Where they are in their ability to process and think is something to just keep in mind, not only working with kids, but their caregivers as well, and supporting them and having some of these more challenging conversations. All right. Another thing to keep in mind, I have to remind this myself of this very often. I think sometimes as helping professionals, we're very quick to want a worksheet or an art project or an intervention, right? Something we can bring into our time with a child, and just remembering that you're the intervention. Um, you are the one that is holding space and really seeing the child and their needs and their emotions and sitting with that and holding some of that with them and for them for a time. And so the only right intervention that is necessary is yourself. And so just taking, what we talk about today in terms of these hands-on interventions, knowing that if you don't have those, right, or don't have the supplies or resources, that you're enough. Um, and that's the most important thing. This is a quote from Gary Landreth, who's considered kind of the founder of play therapy, which I think is really, again, such an important piece to keep in mind when working with grieving children. So he says person rather than problem, right? So not necessarily focusing on grief as the problem in dealing with this child. You're focusing on the person. Who is this child? What are they like in the context of this experience and this trauma or hardship that they've had? Who are they in terms of their relationships? What supports do they have? Present rather than past, right? A lot of times we are meeting kids after they've had something, after they've had the loss. At least at our center, we are, and sometimes I think we can get stuck in focusing and trying to kind of fish in the past, and just allowing the process to live in the present. And knowing that the kid might dip back there from time to time, and you following their guide, but staying present and seeing what you're seeing right in front of you. feelings rather than thoughts or actions. So again, some of that kind of um, normalizing the process of grief and the thoughts and actions that kids might have, understanding rather than explaining. I think this is a really important one with parents. I sort of view my role as I'm not the expert, right? I'm not the expert on their life or their experiences or their feelings of loss. I know a lot about grief and loss, but I don't know their experience. Accepting rather than correcting, same kind of thing, right? Accepting the experience of the person, the child in front of you, rather than trying to fix it. Um, Child's direction rather than therapist's instruction. So similar, right? You're the intervention. Trust the child. Trust that they know where they need to go and what is going to be helpful and supportive to them in their grieving process, and view yourself as a learner and a support rather than giving intervention after intervention after intervention to help them to open up. Child's wisdom rather than therapist knowledge. Similar, right? We're trusting the kid and their process. So again, I kind of shared with you that I'm a play therapist. So this is sort of my my framework in working with kids and teens. There's certainly a lot of different frameworks in counseling and helping professions, but this is sort of where I operate from and wanted to share it with you today in terms of working with children and adolescents. Some things to consider when working with children who have experienced a loss. Just, I think, in terms of kind of assessing in the beginning, right? And thinking a little bit about the case and what you're seeing and what has happened. So, whether or not the child was told about the illness or what happened or the events of the death, just so that you sometimes, I think, as helping professionals, we from talking to parents might know more about the actual situation than the child or teen that we're working with. So just making sure we have a really clear understanding of what the kid knows and doesn't know. I think keeping in mind the family's culture in terms of illness, death, and what they choose to share or not share with their kids. You might have professional feelings about what should or shouldn't be shared, but keeping in mind culture is really important here. I think it's also important when you talk about rituals and routines associated with grief and loss. What is the child's history with loss, right? Have they experienced other losses in their life, or was this their first major loss? Have they experienced other types of losses that are not necessarily death? Has there been divorce? Has there been moves? Has there been lost friendships or bullying? So, what is the child's experience with loss, and how have they coped in the past? And then thinking about the relationship that child had with the person who died, thinking about when the last time they interacted with that person and what their overall relationship was like can kind of give you some context to into some other things kids might be thinking and feeling, and some aspects of complicated grief that might come up in your work with them. So just kind of some things to think about as you begin to kind of go into meeting kids and families that have experienced a loss. In terms of working with the family, again, consider culture, right? You coming into a role in helping someone that has experienced a loss. They might have different ways of understanding grief and understanding death and what that means to them as a family. And so making sure that you are a learner, right, of their environment, of their belief systems, and making sure that you incorporate some of that into your work with the child. Providing education is a really important piece. Kind of back to Gary Landreth's point, right, of towing that balance of providing education, but also kind of going into the conversation with families as you're not the expert, right? And knowing that families might not be able to take in all of this education and information all at once. I think the education for families that's particularly important can be on this developmental stages, right? And what's considered normal grieving. And so that there's things that they can expect, and there's things that they can kind of find maybe a little bit of relief in, that their kiddo might be a little bit more anxious and want, mom or dad or sibling by their side more than is typical. So providing education, I think that normalizes, is really important. I think it's helping professionals to encouraging caregivers to allow children to ask questions and then answering them truthfully. This is a huge thing we talk about with parents in our groups and in individual counseling, is that oftentimes when children experience a loss, it can make them very mistrustful, right, of the world, of people around them, especially if it's a traumatic loss. And so they need to know that the adults in their life are adults that they can trust. A lot of what the research says is that when kids are beginning to ask questions, oftentimes it means that they're ready to hear some of those challenging answers, right? And we as caregivers and adults in the lives of children can give them information that's hard to hear, as long as we're doing it with developmental appropriate language and we're surrounding them with support. So we encourage caregivers to answer questions truthfully, right? If kids are asking and being that person that they can continue to rely on. We also want parents to be aware of their own grief reactions, right? And know that sort of that metaphor of putting your own oxygen mask on first is really important. Oftentimes, families that come to our group, caregivers and guardians are grieving themselves while they're parenting a grieving child. And so encouraging them to have space to grieve, but also knowing, sharing with them that their kids are watching. And so sometimes normalizing their own feelings is really helpful to children. But oftentimes, right, this can allow children to feel like they can't reach out to caregivers because they're worried about making them upset or angry. So just bringing awareness, right, to what your needs are, and what the needs are rather of the family unit and the caregiver as well, if you're working directly with a child. And again, I've talked about this a lot, but just encouraging caregivers to use developmentally appropriate language with kids. So for example, in younger children who have experienced a suicide loss, we'll share with parents to use language such as "they made their body stop working," and this is called suicide. And so things like that, right, where kids are, you're giving them some language to understand, but breaking it down in a way that makes sense to them. So we're going to talk a little bit, we're going to dive into some kind of hands-on interventions. And again, when I say hands-on, these are sort of go-to things that you can do in your work with grieving kids. But remembering that your space, the space that you're holding for kids, is by far the most important thing. So I think the number one thing in really any kind of helping or counseling relationship is establishing safety. I think this is especially true for grieving kiddos too, especially those that have experienced a traumatic loss. Oftentimes kids worry that they're going to get close to people and they're going to lose them. So establishing safety in the context of a relationship is really important. Some ways that I like to do this are using mindfulness and grounding. And this gets at real physical safety, right? So, physical safety in the space that they're in so that they can feel safe in sharing their big feelings. If you're not feeling safe in your environment, it's not going to feel like a safe place to open up. So mindfulness and grounding, those tools can look like we do 5, 4, 3, 2, 1. So 5 things you see in this room. Tell me 4 things that you can hear, 3 things that you can touch, 2 things that you can smell, and 1 thing that you can taste. So just allowing kids, kind of goes back to this present versus past, right? Allowing them to feel safe and grounded in their space and their space with you. A safe place box is one of my favorite things to do. You can have kids create a box that represents a safe place for them, or you can have them have like a little object, or character or figurine that they have, and invite them to just use any kind of box, right? These are from AC Moore or Michaels. They're $1, and they can just decorate the inside of the box to create a safe place for an object. I think this is a great tool because it gets at the idea of and allows you to assess a little bit for what the kid views as safe, right? And what things are helpful and safe in their environment. And also, allows you to kind of talk a little bit about things and coping strategies that support them in feeling safe. A safe place drawing is similar. So you can invite child or teenager to draw or paint a safe place. I think it's important to remember sometimes, though, that this idea, right, might seem confusing to kids. So using the language maybe of an all fine place, right, maybe a place where they feel good and they feel comfortable. I often usually also have pictures because sometimes when you're working with kids that have come from really traumatic backgrounds, they haven't had a place where they felt safe. And so having one that they can choose, whether it's a nature scene, right? Just so they have some options and they can kind of look at one of these for the activity where you're talking about a safe place. For the safe place drawing, I ask kids to kind of imagine that they're looking around and notice what they see in this place. Think about all the places that they've ever known and what about these places made them feel comfortable and safe. Use your five senses. Notice things you see and hear and feel and touch and taste and can smell. And then think about any boundaries. What are some things that we would need to put in this place to make them feel more safe? What kinds of people would be there? What things wouldn't be there, right? It's a good way to kind of assess safety in the environment, but also sort of something to come back to at the beginning and end of session to bookmark to support them in feeling safe. Transitional objects are awesome. I think they help kids in feeling safe and knowing that there's something that's going to be used in your sessions throughout. This is, I call him Feelings Frank, and I use him in a lot of my sessions with young kids because I know he's going to be there, right? And they know that he is an object or a character that they'll see over and over and over again. With grief, sometimes kids will have things that belong to their special person that they'll want to bring into your time together. And that can also be a great transitional piece that they hold on to or feel or touch while you're kind of talking about some of these difficult things. Sensory pieces are really kind of like mindfulness and grounding, a great way to support um, children in establishing safety. So one of my favorite interventions is to have children trace their hands on a piece of paper. And in the middle, they draw the safe place or kind of write some things about the safe place. So if their safe place is the beach, they would draw a picture of the beach. In one of their fingers, they write things they see at the beach, they hear, they taste, they touch, and they can smell. And then I remind kids that they can kind of always go back to this place, right? Like, what are the things I see, hear, taste, touch, and smell? So, really bringing in the sensory experience is important in establishing safety. This is an intervention that I love in terms of talking about feelings. So this is called the tangled ball of grief. So H. Norman Wright came up with this sort of visual of the ball of grief and the ball of tangled emotions. So you can see sort of all of the feelings that are present within that ball. And so I kind of talk about this and introduce this with kids. Sometimes I'll have a ball of yarn and toss it back and forth and talk about how everything feels confusing and it's all stuck together and what are some of the feelings in there, and invite them to kind of create their own tangled ball of grief, whether it's, physically they're kind of weaving it together to show me what it looks like, or they're using markers or crayons to kind of show what their ball looks like and have some different colors that represent different words for them. This is a great metaphor in talking about grief, right? Because we can kind of take out one thing at a time. With this one on the left, right, the blue that represents sadness. We might talk about how that one looks a little bit hidden, and how can we take it out for a little bit today? What does it look like? And you can kind of get a good sense too of where and what kids are experiencing. This is a good one too. You can kind of use this as a check-in, and maybe after you've been working with a kid for a few months, you can revisit this activity and hold on to the one they did first and see what's changed. Right? Are their feelings of worry less? Are their feelings of sadness less? But their feelings of anger are more. It's a good way to kind of check in and to revisit. I think that grieving children um, really struggle and feel alone and isolated because it feels like there's so much change, right? There's this initial loss that they experience, which we kind of talk about as being almost like an earthquake. And then there are these other changes or other secondary losses, kind of the aftershocks, right, that occur after the loss. So I think bringing in interventions as a therapist or counselor that you can talk about this theme of change are great. Genograms are awesome. We use these a lot in social work, but genograms are sort of family maps, right? So if you have never seen a genogram before, it's just kind of a map that represents the family. And so there's different lines that represent different relationships. And so kind of using this with kids or teenagers to show what's changed in their family and relationships with people that have changed in their world, is a really great way to kind of talk about some of these changes with people and these secondary losses that kids might experience as a result of their initial loss. Tree of Change is another great one. There's a great book called The Fall of Freddie the Leaf that talks a lot about using the kind of metaphor of trees and change, and relating to grief and loss. This one's really simple. I usually just provide kids with some pre-cut leaves and or invite them to draw their own tree. And on the leaves, they write or draw things that have changed since the loss, right? Inviting them to explore things in their environment, things in their relationships, things in their mind, their feelings, their thoughts that have changed since they lost their special person. Collage, so using kind of magazine cutouts is a great one to explore change. Doing a before and after collage of your feelings before and after, your life before and after, and just kind of allowing them to explore this idea of change and give a visual to that. Another hands activity that I love is inviting kids to trace both of their hands. And one hand, they paint or draw or again collage things that they want to hold on to, right? About their lost loved one, about the experience, and things that they want to let go of. It again kind of allows them to explore this theme of change in a healthy way and feel supported, and having someone hold space and normalize some of those thoughts and feelings that they're having. Some great books and resources. I think that our blog is really a great resource if you're working with um, grieving children or families. We have a lot of great articles that either we've written ourselves or have shared, and some other videos. Our Instagram and Facebook are also great resources as well. One of my favorite books is by Liana Lowenstein, and it's called Creative Interventions for Bereaved Children. She's got a ton of resources in there that, again, we have utilized heavily in our groups and with individual counseling clients. There's interventions that talk about assessment with grieving children, and there she kind of breaks down some themes in there. It's a great book. Draw It Out, Chill and Spill. These are art journals, so they have a leader's companion as well, but they're kind of a great place if you have kind of the financial resources, a great starting tool to kind of allow kids to be in the practice of drawing and creating some things about their feelings and experiences. And again, Art with Heart is the organization that has those journals out, and they have Leaders Companion for both the Chill and Spill, which is for younger kids, and the Draw It Out, which is for more adolescent age range. Um, and they've got all sorts of art-based interventions in there. The Invisible String is a book that we use really frequently. And so I think this is a great book to talk about grief and loss in terms of a person, but it's also great in the world that we're living in, right? Where we're not necessarily able to see people and there's a physical distancing that's occurring. It talks about how we're always connected to the people that we care about, and that connection doesn't go away when those people are upset or angry. There's also a workbook that has some good um, worksheets, but also some kind of art-based interventions. And some of our favorite websites are the National Alliance for Grieving Children and What's Your Grief. What's Your Grief has a lot of good hands-on resources and tools as well. So I hope that this kind of gives you just some ideas of some things that we kind of use in our groups, and again, our individual work with kids, some hands-on things that you can kind of have at the ready to do in sessions. But just remembering too that the thing that you can do to support grieving children and families the most is to be there, right? You're the intervention, you're the support. Um, Again, if you have any questions at all, I'd be happy to answer them. We also use a lot of books in our work with kids and teens, and we have what's called a bereavement resource manual that we put together for the Richmond community, which not only has a list of therapists and specialists in our area specializing in grief and loss, but there's some great handouts for parents and sort of normalizing grief and loss. And like I talked about, those developmental stages, there's some pieces in there as well. But there's also children's books and books for teens that we recommend. I use bibliotherapy and books and sessions with kids a lot. I think it can be a great way to kind of give them a little bit of information, right, or education about loss. And then do an activity around it, or invite the caregiver in for the session, or invite the caregiver to share the book with the child at home. So books are a great resource as well, and you can find the ones that we recommend in our bereavement resource manual, which is listed. Thank you so much for being here, and again, thank you for the work that you're doing in our community. We really appreciate you. Feel free to reach out if you have any questions at all. Thank you so much.